Again, thank you for the invitation to come back to speak at JCC. This is actually an annual talk I've been giving now. This is my third year. And I really enjoy giving this talk because there's just so much about migraine and headaches that people don't understand. And so if I can just shed some light and help people understand what's going on and different ways that they can manage their headaches, that's really my goal. And I will leave some time at the end for some questions. So I'll go through my presentation, and then hopefully we'll have maybe about 15, 20 minutes at the end to go through some questions that you may have. So let's see here. Let's see if I can advance my slides. There we go. So I just wanted to just begin with giving you a little bit of kind of insight into, why I'm so passionate about headache treatments and migraine treatments. So I myself am a migraine patient, and I'll share with you my first experience with migraine. It was actually quite frightening. I was in medical school and I was studying for my final exams in my second year, and I was in the library and I'd been there for hours, looking, studying, and not sleeping well and not eating properly. And all of a sudden I started to see some flashing lights in my vision. And first, I didn't know what was going on. I couldn't see what I was looking at, but basically the flashing lights got bigger. They started to have this zigzag pattern, and eventually it basically took over half of my vision. I could not see, and I was terrified. I thought I was having a stroke. And if you've ever had this happen, you know exactly what I'm talking about. What I was experiencing is a visual aura. And, again, if you are experiencing for the first time, it is similar to having a stroke. You can't see and you think, something bad is going to happen. So basically, I went home immediately. I didn't know if I should go to the hospital, even though as a medical student, I knew what migraine was and I knew what an aura was. When it was actually happening to me, I didn't know what to do. And my vision returned to normal in about 20, 30 minutes, but then I got this horrible headache afterwards and I just went to sleep. When I woke up, I realized that I just had my first migraine with aura. And over the years, I would have migraines sporadically, but there was a point in my life when I began to have them basically every single day because I wasn't taking care of myself. I wasn't eating properly. I wasn't sleeping properly. I was under a lot of stress. And so my migraines became chronic daily headaches, and I was looking for solutions. I went to many headache specialists, many very well-known headache specialists in the New York area, and I was basically given prescription after prescription. And none of them worked for me. I took them, they either didn't work or they gave me side effects. So I decided to seek another solution. And really that's what I wanted to talk to you about today is some of the other ways to manage migraines that are not based in medications, not based in pharmaceutical agents, but more natural and lifestyle approaches to migraine management. So with that, I want to talk about, first of all, what is a migraine? So migraine is not a regular headache. A migraine is a distinct phenomenon. And there are three kind of main symptoms that many people with migraines have. And then there are some other symptoms that could happen with migraine as well. So the main symptoms that people get are the headache, of course, light sensitivity, sound sensitivity. Those are kind of the three main symptoms that most people with migraines get. But some of the other symptoms include gastrointestinal type symptoms. So nausea, vomiting, sometimes people even have diarrhea or loose stools, even stomach cramps. And then there are a host of other symptoms people can get as well. So people can get dizziness, a vertigo. They can get, in addition to light sensitivity, sound sensitivity, they can get sensitivity to smells, and they can even get numbness and tingling. So some of these symptoms are, well beyond what you would think of as a headache. Some of them do kind of resemble stroke-like symptoms. So it's really, really important that if you have any of these symptoms and you've never had them before, definitely get evaluated and go see your doctor. It's best if you see your primary care doctor. If you can get in to see a neurologist, that would be great. Or if you're having vision-related symptoms, it's really important to go see an ophthalmologist, perhaps even a neuro-ophthalmologist, because you first want to get that correct diagnosis. And as long as the exam doesn't show anything more serious that would suggest a stroke or something else going on neurologically, then we can call it migraine. But again, migraine, the point I wanted to make here is that migraine is not just a headache. It's well beyond a headache, and it has sometimes symptoms that you would not expect, neurologic symptoms, gastrointestinal symptoms, and other types of just not feeling well type symptoms. So why does migraine happen? Let's go through a little bit about what's going on in the brain that causes migraine. So, so this is kind of a diagram that walks you through the different stages of migraine. So initially, if you look here, the first thing that happens in migraine, migraine is something that begins deep within the brain. And we believe it's something that happens within the brain stem, which is really at the base of the brain. It's at the center of the brain. And the brain stem helps us control many of our physiologic processes. For example, breathing. It helps us control our blood pressure, our heart rate. I mean, there's just so many different parts within the brainstem that control various different bodily functions. So there's some trigger that activates this part of the brain. And then what happens is there is an electrical change that happens in the brain. And this electrical change basically spreads throughout various parts of the brain. So that's step 2. So these electrical impulses spread, and then the electrical change stimulates a change in blood vessels, and it affects blood flow. And in the very early stages of migraine, what we think happens is that the blood vessels in the brain first constrict. And that's oftentimes when people experience their aura symptoms. So for example, the visual aura that I described, you may experience that, or a different type of aura when the blood vessels are constricting. And then after the constriction, the blood vessels dilate. And that's really what causes the headache. So again, initially there's a constriction, then there's a dilation of the blood vessels in your brain. And not only do the blood vessels dilate, what happens in the next stage, which is basically stage 4, is that this dilation releases all these chemical transmitters within the brain. And those chemicals stimulate inflammation. So, so again, there's an electrical change, a blood vessel change, a blood flow change, and then there's inflammation that happens in the brain. And this inflammation, or these chemicals that are released, can trigger various nerves that basically modulate pain within the brain and the face, and sometimes even the neck and the shoulder. So again, there's kind of a sequence of events that happens in migraine. It's not just a headache. It's not just a single event. It's almost like a domino effect where one thing begins and then it just continues down the path. And oftentimes migraines, if you've ever experienced one, it can last for hours, or it can last for days, or it can last for weeks even. So the typical time frame for a migraine can be anywhere from 3 hours to 3 days. That's what we typically see. But sometimes people do have a kind of a refractory or a prolonged migraine as well. And it's because this whole cycle is kind of happening in the brain itself. Now, I had mentioned that certain pain nerves get stimulated. There are many different branches of nerves that get stimulated, but the main nerve that is responsible for pain in the brain is a nerve called the trigeminal nerve. And so the brain itself doesn't have pain fibers, but the brain has a covering, and that covering has pain fibers. So when there are the changes that I described, for example, the blood vessel changes or the inflammatory changes, the covering of the brain stretches and it triggers the pain nerve, which is again the trigeminal nerve, and its many, many branches. So in this diagram here, so I was talking before about the brainstem. So this area that I'm showing you is really the brainstem. So you can see that it's really right in the middle of the brain. But the trigeminal nerve is it's a long nerve. It actually runs like this whole length of the brainstem, but the majority of it sits in the base of the brain here, but it sends a very major branch towards the face. And this is basically a big branch of the trigeminal nerve, and it has what we call a cell body, a ganglion, and then it sends off 3 different branches. And so the first branch kind of goes to the covering of the brain, but it also goes to the eye socket, to the structures within the eye, and to the sinus up here. We actually have a sinus. It's called the frontal sinus that's up here. So oftentimes people who have migraine will have pain along this distribution. So along the first branch of this trigeminal nerve. But sometimes the pain may go to other parts of the face also, or be triggered by different stimuli in other parts of the face. So there is another branch, this is branch number 2, that goes here to the sinuses. So we have sinuses here as well. These are our maxillary sinuses. So sometimes people may say, oh, I have a sinus headache or sinus pain, but it's not really oftentimes a sinus headache. It's probably migraine that they're experiencing from some of these fibers being stimulated. And then there is a third branch that goes down to the jaw. And this is called the maxillary branch. So it goes down to the lower, our gums, our teeth, and then the jaw muscles themselves. So, so again, there are many branches. People can experience pain in any of these branches when they have migraine. The first branch tends to be affected most often. And then I also wanted to point out that there are some nerves here that go to the neck and to the back of the head and also down into the shoulder. So this diagram doesn't show all of the nerves, but these are what we call cervical nerves. And these cervical nerves, they basically intersect with the trigeminal nerve. Now they're distinct nerves, but in the center of the brain, there are connections there. And because there are connections, there are many instances where people will have migraine that actually starts at the base of the head or even in their shoulder and neck, and then it spreads to their head or to their eye socket and they have migraine. So again, there's a lot of interplay between all these small delicate branches of the trigeminal nerve and the nerves associated with the cervical nerves and the occipital nerve, which is what's shown here in this diagram. Now, now many people ask me, Dr. Banik, why do I get these migraines? What's causing the migraine? Well, first of all, I do have to say that even though, we have tremendous advances in medicine, we understand the brain much better than we did 100 years ago, there's still not well understood why exactly people get migraines. So it's really still a big medical mystery in terms of what is triggering these migraine attacks. But I can say that one thing we really understand very well now is that there is a major genetic component. So basically, it's not just one gene. There are numerous genes that have been associated with migraine. But the general thinking is that if you have migraine, there is a 50% chance that you will have, or probably more than 50% chance that other family members will also have migraine. So oftentimes, I'll ask my migraine patients, did your parents have migraine? Do your brothers or sisters with migraine? Do your children have migraine? And more often than not, the answer is yes. So it may sometimes skip a generation, but oftentimes there is a family history of migraine. So sometimes you have to delve deep because people may not make that connection. My Aunt Sally used to get these headaches, but nobody ever really called it migraine, but perhaps it really was migraine if you yourself have migraine as well. So there's that genetic component to it. But just because you have a family history of migraine does not mean that you are destined to get migraines. There are other triggers. There are plenty of people who have a family history of migraine who never luckily develop symptoms, but oftentimes these other triggers are what may cause them to actually manifest symptoms. And oftentimes the triggers are lifestyle triggers. And that's really where, what I was talking about before, that there are many different, kind of forms of migraine, many triggers for migraine, but there are also many natural therapies and approaches to dealing with migraine, because if we can control these lifestyle triggers, we can really help to lower our threshold for migraine. So again, you can't change your genetics, but you can, if once you know what those triggers are, you can modify your lifestyle habits. So let's go a little bit more into depth about some of these other, what we call epigenetic factors. So yes, we have the genetic factors, but then there's the epigenetic factors that really play into whether people actually have symptoms or not. So first and foremost, I'll just say nutrition is probably one of the most important epigenetic factors to consider when thinking about migraine. And I'll talk a little bit more in detail about that. For many people, exercise, I'm sorry, there's a typo right here, but exercise may actually be a trigger. For example, strenuous exercise. I have many patients who, they've been working out at the gym, or they've taken a brisk walk or a brisk run, and all of a sudden they develop migraine symptoms. So that can actually be a trigger for many people. Now, what's going on in the environment can also be a trigger for many people. I actually just did a post on my social media today about this, about the weather triggers for migraine. So changes in barometric pressure, changes in temperature, can oftentimes trigger migraine symptoms in many patients. And then finally, as a kind of a large category, I'll just say emotional health can be a trigger, an epigenetic trigger for many people. So what I mean by emotional health is basically stress level. And again, I'll talk a little bit more about that in detail in a couple of slides. So if you are predisposed to migraine, or if you know someone who's predisposed to migraine and you want to help them, the most important thing you can do is to first sit down and be a detective and try to identify what your triggers are. So let me go through some of what the potential triggers may be. So first of all, food sensitivities. For many people, it could be dairy. It may be gluten sensitivity. It may be too much sugar in the diet. It may be certain types of oils. I actually had a patient who told me, she kept eating this salad from Whole Foods, and you would think that Whole Foods has very healthy whole food, but in the salad there happened to be a particular oil, canola oil, and that was triggering her migraines. And once she cut that out, when she stopped eating that salad, which you would think would normally be healthy, but that salad was actually triggering her headaches because of one of the ingredients in the salad. For some people, food sensitivity may be MSG. And MSG stands for monosodium glutamate, which is an additive put in foods as a preservative. And it is oftentimes added to packaged foods. It's also added to a lot of, for example, Asian food, takeout food. But that is a big trigger for many people, MSG. For other people, triggers may be nitrates or nitrites, oftentimes found in preserved foods or fermented foods. Some types of wine actually have nitrates and nitrites, and so that may be a trigger for some people. Beer can be a trigger for some people. Chocolate may be a trigger for some people. Cheese. So again, you really have to, in terms of figuring out if you have certain food sensitivities, you really have to be a detective and try to think about, if you just had a headache, if it triggered your migraine, what did you have within the past 24 to 48 hours in your diet that may have potentially triggered that headache. So it's really, really, really important to look through your diet history. So moving on, other triggers for many people, dehydration is a major trigger. And I was talking before about how some people have developed migraines after exercise. Well, oftentimes it's not necessarily the exercise itself that may have triggered the migraine. It's probably because they were dehydrated after that rigorous exercise that triggered their headache. Many times people will get migraines because they've been out in the sun too much. And so yes, light can be a trigger, but oftentimes they get dehydrated, and that's the trigger. And so that is oftentimes a major, major trigger for many people. So it's important to think about your hydration status, where you're getting your fluid from. Is it from drinking water? Is it from drinking other types of beverages? Make sure that you're drinking, if you're drinking a lot of caffeinated beverages, you really have to balance that out with drinking beverages that are non-caffeinated, because caffeine will dehydrate you. So you want to really make sure that you have that balance. And oftentimes in terms of when you're thinking about hydration, many people think of how much fluid they're drinking, but many foods also have hydrating, characteristics. So for example, many fruits and vegetables are mainly made out of water. Some of them are, over 90% water. So when you're thinking about hydration, think also about the foods that you're having that are potentially hydrating. Okay, so poor sleep is another major factor for many people, myself included. I can tell you that this is something that I'm still working on, is trying to get better sleep habits, better sleep hygiene. But oftentimes people will say, I was really, working hard to meet this deadline. I really have not been sleeping very well the past few weeks. I'm probably only getting maybe 5 hours of sleep or even less. And, my migraines have been horrendous. They've been really, really difficult to manage. And it really comes down to getting rest and getting proper sleep, adequate sleep. So think about that. And then musculoskeletal issues. I was mentioning before about some of the nerves that kind of intersect with the trigeminal nerve. Many times people will have a neck issue or injury or sports injury, either in their neck or their shoulder, and that can be a nidus for a migraine trigger. So it's important to kind of think back. Have you had any neck strain? Have you had, for example, people who've had a car accident or a concussion with neck injury? Sometimes those people are more predisposed to migraines as well. And it's important to really consider that in your as your trigger, but also in the treatment, because the treatment of that sometimes can improve the management of migraine as well. Another major trigger for many people, particularly women who are in, let's say, the late teen to about 50, 55 age group. And that's a very broad age group, but for many of those women, their trigger is their menstrual cycle. And so, it's important to think about, when you're doing your kind of review, your detective work, do your migraines really correspond with your menstrual cycle? And for some people, they may actually get their headaches before their menses or before their cycle begins. For some people, it's around that time in that perimenstrual period. So within, the first couple of days of starting their flow, they may develop a horrible headache, and it may be very cyclical. Every month they're getting these symptoms. And we don't exactly understand why that is. It probably has to do with a sudden change in estrogen. As soon as women begin to menstruate, that can be a trigger for many people. And for others, it may be later on in their cycle when their progesterone and estrogen levels are changing. That's perhaps when they're getting their migraines. So every person is different, but definitely the menstrual cycle is important to consider when thinking about migraine triggers. I also just want to mention that oftentimes, women will get horrible migraines when they're menstruating, and then during menopause or when they're about to go into menopause, their migraines improve significantly. So that's actually a well-known phenomenon where people may actually benefit from going into menopause because improved headache frequency and severity. Now, the flip side can also happen. There are definitely women who perhaps have never had migraines, and all of a sudden they're going through menopause or they've reached menopause, and now they're starting to get horrible headaches. And in some cases, hormonal therapies can be effective and helpful for those types of patients, but that's really on an individual basis. Now, moving on. Toxins. So we live in an environment that is full of many different types of toxins, some of which we can identify, some of which we don't know are there. So there are toxins in the air, there are chemical pollutants, there are toxins in the products that we use. For example, in our personal hygiene products, whether it's our shampoo or our soap or our deodorant, there are certain toxins in there. So, if you are prone to migraine, you really want to do a kind of an inventory of what are you using in your home, on your, on your body, for your personal hygiene. Where could toxins potentially be coming from that may trigger your headaches? For certain people, mold may be a major trigger for their migraines. So sometimes it's important to do a mold assessment in their home or their home environment to see if that may be a trigger as well. And then stress, which is, I was talking about this before when I was talking about epigenetics and emotional triggers. Stress is, I would say, by far, I would say it is the most important trigger for most people who are prone to migraines. And what I will say about stress, just very briefly, is that stress is a part of our lives. We all have stress in some form or another, and actually, it's actually good to have some degree of stress because it provides motivation. But too much stress, whether it's coming from your work environment, from your home environment, from school, from your neighbors, from your family members, whether it's a financial source of stress or whatever health reasons, health issues can definitely cause stress. Whatever the source of stress is, we all have to find ways to manage it because we all have to deal with stress, and we have to find ways to modulate that stress. So hopefully it doesn't impact our headaches and our and be a major migraine trigger. And I'll talk about some of the ways that you may be able to modulate stress in just a little bit later in the talk. So there are many things to consider when it comes to figuring out what's causing your migraines or what your triggers are. And so it's important to keep a headache diary or migraine diary. There are a couple that you can download from from online. This is just a sample headache tracker, and basically it will allow you to keep a log of your symptoms every day. So you put the date here and the time, what's going on in the day, what types of food are you eating, did you take any medications, what activities are you doing? And then also you can log your pain on this pain scale from 1 to 10, it should be 10 actually. And you can also draw in the location of your pain, what the weather is like, the barometric pressure, the temperature, whether it's sunny, overcast, raining, cloudy, and any other notes. It's important to do this. If you are prone to headaches, get yourself a headache tracker, print out a bunch of sheets. If you want one, I actually had, I created one, and my staff can email it to you if you're interested in a headache tracker that I use in my practice. But it's very, very helpful. Now, there are also some apps that are great headache trackers. So so if you're interested in that, you can also email me, and I'll provide you my email at the end of the talk, and I can send you some of the apps that I've used for myself and my patients that are very effective in helping you track your symptoms. Also, it's not included in here, but again, you can track your sleep and your menstrual cycle as well using this type of a headache tracker. So now let's really go on to kind of the crux of the talk, which is, how do we treat these headaches? What are really the best approaches to managing these headaches? And I know I had mentioned before that when I would go to the various headache specialists in New York, basically, they would listen to my story, they would ask me about my symptoms, and they would pull out their prescription pad and write me a prescription for the latest and greatest new headache medicine on the market. And so basically, I went through different pharmacologic agent after agent after agent, and basically none of them worked for me. And, I can probably think of at least 10 different medicines I may have tried over the years, headache treatments that are well known and used very frequently out there, and they just were not working for me. So what I will tell you is that most of the treatments used for headaches, basically, they put a Band-Aid on the problem. They help to treat the pain, but they don't necessarily get to the root cause of the problem. For example, where is it coming from? Address the cause, address your triggers, address those epigenetic factors that you can control and change, rather than to take a pill that will put a Band-Aid on the problem and perhaps even cause side effects. So I really, once I shifted my mindset into saying, I'm not just going to take this and, basically, ignore my symptoms or, suppress my symptoms. I'm really going to try to figure out what is triggering my headaches. Then my whole kind of journey began to change, and I finally started to get better in terms of my headaches. And, this required a lot of research on my part, because my headache doctors didn't necessarily offer me any of these treatments. And, not once in all of the doctors that I saw, not once did anyone ask me, well, let's talk about your lifestyle. How much sleep are you getting? What are you eating? What are you drinking? How much do you hydrate? How much caffeine do you have? How much stress do you have? So not one of my doctors asked me those questions, but when I started to ask myself those questions, I really realized that I wasn't taking care of myself. And once I started to take care of myself, that's really when the transformation began to happen. So, again, if you do suffer from headaches, or you know someone who does, or you have a loved one who does, really kind of think about your triggers rather than saying, okay, let me just pop this pill and hope that my symptoms are going to get better. So, basically what I did was, through trial and error from myself, and I began to try this on some of my patients as well, I began to steer away from pharmacologic treatments and really use some of these other principles to guide my management of migraines. And so what are some of the principles that I use for myself and my practice? So that's what I'm going to teach you today. What you want to do is, we all have a threshold for migraine. Our brain wants some sense of regularity. The brain craves routine, it craves schedule. And when we're off that schedule, it's much more likely that a migraine will get triggered. So we all have a threshold for migraine. And so basically what you want to do is to raise that threshold. So no matter what else was going on down here, no matter what your triggers are, you hopefully won't meet that threshold, which will lead to a full-blown migraine attack. So you want to, again, raise that threshold, not lower that threshold. So how do you raise that threshold? So I really, in my practice, I use a multi-pronged strategy, and I call this the Conquer Your Headache kind of approach. This is a kind of it's a program that I've developed where it's founded in 3 different things. So nourish, you want to nourish your body with the proper nutrients and hydration kind of strategies that I talked about. You want to balance, anything that's going on within your system, whether it's a deficiency or a hormonal issue. You want to balance that. And then finally, you want to calm yourself. And this is where the stress management comes in. So let's go through some of these principles here. So, it was said that Hippocrates, who was considered kind of the father of modern medicine, he's a Greek, he was a Greek physician back in the, I believe he was 400 to 500 AD. That's when he lived during that time. He once said, "Let food be thy medicine and let medicine be thy food." So this concept of food as medicine, what we eat will really help to determine the status of our health and help prevent disease, is actually, it goes back even beyond Hippocrates, even though he was the one who's credited with saying that. It actually goes back to ancient Mesopotamia and ancient India and ancient China, that the principles of using food as medicine. And really, again, what you eat will determine the status of your health. So what I found is that there are numerous nutrients that come from plants that help us in terms of our energy production, especially in terms of energy production within the brain, that help to decrease inflammation, to provide antioxidant benefits. So nutrition is, I would say, the cornerstone of treating headaches naturally, proper nutrition. So what does this mean? So what I've shown you here is a picture of lots of different colored fruits and vegetables. So, people always ask me, is there one particular fruit or vegetable I should be eating? And I say, it's not one single thing that you should be eating. It's a variety of things that you need to be eating. So you see here that I've shown you lots of different colors. So you want to get in your diet a rainbow of different colored fruits and vegetables. So you have your greens, your different shades of greens. You have your yellows, your oranges, your reds. You have blues, purples, and even blacks. And you want to rotate through all of those colors in your diet to provide you with the nutrients, the micronutrients your brain needs to function properly and to promote energy metabolism in your brain. Now, the other, I'm kind of giving you the framework, and of course in my practice I go much more in depth and detail in terms of which specific nutrients come from which foods. But one thing I always say is you want to, when you're thinking about nourishing, yes, you want to have those plants in your diet and rotate through the plants, but you also want to avoid the SAD diet. Now, the SAD diet stands for the Standard American Diet. And what that is basically, it's a diet which is high in simple sugars, it's high in unhealthy fats, and high in processed foods. So you want to avoid that type of a diet. And unfortunately, many of us, and I was on this diet for many, many years as well, but you want to avoid that type of diet and again, steer more towards a plant-rich diet. Now, I'm not saying it has to be plant-based. You don't have to be vegetarian or vegan to do this, but you want to have a plant-rich diet and have all those colors in your regular diet. You also want to stabilize your blood sugar. So oftentimes people will get headaches or develop migraines when their blood sugar goes from being very, very high to suddenly dropping down and being very, very low. And so you want to avoid foods that have a quick sugar release. Again, some of those SAD foods will do that. So you'd want to avoid those sudden fluctuations in your blood sugar. And you can do that again through eating more balanced diets. And I'll show you kind of what a balanced diet would look like. You also want to identify and avoid those food sensitivities and food triggers that I was talking about. So whether you are sensitive to MSG or gluten or dairy or nitrates or sulfites, you have to be a food detective and figure out what it is and avoid those foods. Or at least I would say avoid them for a certain period of time. This is trial and error to figure out, what is it that's triggering your migraine. So if you're going to avoid it, I would do at least 3 weeks, perhaps even 3 months of trying to avoid a particular food to see if that's your migraine trigger or not. And then once you've avoided it, see how you feel, and you can slowly start to reintroduce the food or food group and see if you have a reaction to it. See if you start to develop symptoms. And if you start to develop migraine symptoms again, then you know that, yes, you are sensitive to that particular food, and it's something that you should probably avoid going forward in the future. In my practice, I use something called a mitochondrial diet for many of my migraine patients. And this is a diet which contains 12 therapeutic foods. And these foods are beneficial for brain health, but also they also happen to be beneficial for vision health as well. So yes, I'm also an ophthalmologist, so it's important for me to promote vision health. And the mitochondrial diet really does provide all of those nutrients that people need to keep their brains and eyes healthy. And this is just kind of an example of what a mitochondrial diet or a meal would look like. So basically, if you take your plate and you divide it up, so half of your plate should be fruits and vegetables. And you can see here that many different colors are represented. Now, a lot of people ask me, do I have to eat them raw? No, you can have them whatever way you like. You can have them raw, you can have them cooked, you can steam them, you can even make a smoothie out of them. But whatever way you like it, make sure that you're filling up half of your plate or at least half of your meal with different colored fruits and vegetables. Now, next, you want to have a quarter of your plate being high protein food. So here, you can have meat in moderation, you can have egg, you can have fish, other, beans, other types of plant sources of protein, but whatever, tofu, whatever, wherever you get your protein from, again, it doesn't matter whether you eat meat or you eat fish or whatever it is, you can kind of rotate through different sources of protein, but a quarter of your plate should be that source of protein. And then a quarter of your plate should be whole grains. So you notice that there are no simple sugars here on this plate. If you're going to have, if you love to have rice, switch from having white rice to more brown rice. It's more of a complex carbohydrate. So again, you want to have just a quarter of your plate being those whole grain foods. And also, this is very important. It's really important not to forget this. Make water your drink of choice, because it's important for many reasons. I mentioned hydration, but it's also important to help you digest your food and detoxify. So you want to include plenty of water there. And of course, yes, if you want to have a little bit of, some other type of beverage, that's fine as well. Just make sure that it's all in moderation. So if you're having a little bit of wine, if it's okay for you, it doesn't trigger your migraines, have a little bit of wine. Or if you want to have, some other beverage, make sure it's not caffeinated. That's the other important thing. Also, I was just talking about this. A lot of people ask me, Dr. Banik, how much water do I need to be drinking to really hydrate well? Well, this all varies depending on you, your body size, the health of your overall health, whether you have any heart issues or not, or kidney issues or not. So a general rule of thumb, now again, this doesn't apply to everyone, but a general rule of thumb is you want to drink enough so that when you pee, when you urinate, your urine is a very light straw color. If it's dark, it means you're probably not drinking enough. Another kind of rule of thumb that you can use is, I tell my patients, you can take your weight in pounds, divide by 2, and that's how many fluid ounces of water you should be drinking every day. So for example, if you weigh 150 pounds, 75, half of that is 75, you should be drinking 75 ounces of fluid every day. And it may seem like an ocean of fluid, an ocean of water initially, but you can work your way up to that. And also, again, it does not have to be only water. You can have other types of beverages, just not caffeinated. Don't count those caffeinated beverages as part of your fluid intake. And you can also eat your water. So I was mentioning before, plenty of fruits and vegetables are rich in water content. So you can count that towards your fluid intake as well. Now, what about caffeine? I've mentioned caffeine a couple of times here. Caffeine and migraine is really a double-edged sword. In some cases, if you don't have much caffeine, caffeine can help break a migraine attack. But if you have too much caffeine, that can actually trigger, it's almost like a vicious cycle. It can actually continue your migraine attacks and propagate migraine. So what I would suggest is, if you are prone to migraines, you want to limit your caffeine intake and try to reduce it down to 1 cup of coffee or caffeinated beverage or less per day. Now, I can tell you that when I was at my worst in terms of my migraines, I was a caffeine addict. I was having anywhere between 8 to 12 caffeinated beverages a day. And, the more caffeine I would drink, the more I felt like I needed to have to keep my headaches under control. So it was almost having a or rebound deleterious effect. So once I started to cut back on my caffeine, I realized I really don't need that much. And my migraines also really started to improve significantly once I made that lifestyle change and lifestyle choice. I know it may be very difficult to do, especially, if you're used to having caffeine, you need it to get by. But what I typically say is don't go cold turkey. Your brain is not going to like that. Your body is not going to like that. So instead of doing, just a sudden, stopping caffeine, you want to reduce your caffeine intake and slowly. And what I typically suggest is reduce it by half a cup a week. So if you're drinking 4 cups a day, slowly go down to 3.5 cups for a week, and then 3 cups for a week, and so on and so forth until you've gotten down to 1 cup a day. Now, if you can cut it out completely, kudos to you. Great, that's great as well. But most people, they do need a little bit of caffeine to get by, and caffeine also has some great antioxidant properties. So, you still want to reap those health benefits by having some caffeine in your diet. And also keep in mind that there are other sources of caffeine that you may not realize. Most people think of caffeine as, coffee or tea, but there are, caffeine, there's caffeine in chocolate. There's caffeine in some of the health food or health drinks out there on the market. So, just be very cautious and look at the label. There's caffeine in kombucha also. So really look at the label and try to figure out how much caffeine are you having every day, and try to keep it, I would say less than 100 milligrams a day if you are prone to migraines or chronic migraines. Now, moving on to the second kind of foundation of my Conquer Your Headache approach, it is balance. And so this, this is balance in many different aspects. So, we have to balance our bodies, meaning the electrolytes within our bodies, our hormones within our bodies. And then we also have to balance some external factors as well. So this is really a big category. And this is something when I sit down with my patients, when I'm in the office talking to my patients, it really does take time to figure out where is imbalance coming from in their bodies and in their lives. So I'll give you just some examples. Many of us, in general, in the population, whether you have migraine or not, many of us are magnesium deficient. And this is because of, it's simply due to agricultural practices or nutrition practices, but many of us are deficient in magnesium, and magnesium deficiency has been linked to migraine. It's a well-known, fact that people who are prone to migraine are deficient in magnesium. And so it's important to replace magnesium with either through foods, magnesium-rich foods, or through supplements. So in some cases, supplements are really important to restore balance for people who suffer from chronic migraine. Now, B complex, or vitamin B, there are many different types of vitamin B, but B2 in particular, which is riboflavin, has also been shown to be a key factor, or deficiency of B2 has been shown to be a risk for migraine. And so oftentimes for my migraine patients, I do start them on a B complex, or perhaps even just B2 riboflavin as a select nutrient that I have them supplement with. And then in some cases, especially if people are prone to menstrual migraine, what I was talking about before, or perimenopausal migraine or postmenopausal migraine, it's important to try to balance their hormonal environment with estrogens. And rather than to start someone on an estrogen supplement or estrogen replacement, which is something I really don't recommend for many people because of the potential risks, I do sometimes recommend phytoestrogens. And what that is basically there are plant compounds that are similar to estrogen, and they can be taken either as a nutrient or an oil or some other form that can be used to try to balance out one's hormones, especially if you're prone to those types of migraines. So, or even as a tea, there are phytoestrogen teas out there that can be quite helpful. And then other ways to balance inflammation, I mentioned, is really a key component in chronic migraine. So once that trigger gets, it happens in the brain, oftentimes the inflammation just continues in a vicious cycle. And so anti-inflammatories are important. And one natural way to try to decrease inflammation is to use white willow bark. And some of you may have heard of this as a supplement or botanical agent, but white willow bark is a cousin of aspirin. So it's in that category of a salicylic acid, or it's related to salicylic acid. And so sometimes that can be helpful as well in kind of prevention strategies for migraine or treatment of migraine. And then finally, curcumin, which is a natural antioxidant, but it's also an anti-inflammatory compound. It's found in turmeric. That can also be used to restore balance and reduce inflammation. So I want to make sure I leave enough time for questions at the end. So I'm just going to go through the rest of my slides fairly quickly, and then hopefully we can open it up there to any questions that you may have. So part of balance I was talking about before is not just external factors, so internal factors, but also external factors. And so sometimes kind of restoring balance through movement, and and exercise is also really important, and that helps balance both your external being as well as your internal being. So movement, there are different types of movement. Some patients tell me, well, Dr. Banik, I can't exercise, I have this pain. I find it hard to find some form of exercise that suits me. There are many types of movement. It doesn't mean that you have to get up and run a marathon. It doesn't mean you have to do a triathlon. You don't have to do any particular type of exercise, but movement in itself, it could be many different types. You can do yoga, you can simply walk, you can do, you can swim, you can do deep breathing exercises. There's so many different types of movement you can choose from. Other ways that to kind of rebalance musculoskeletal health is to use acupuncture. So that's also been very effective for people with migraine. And it's not something where, you go to one session and you're cured. That's not what's going to happen. You really have to go regularly. And I usually recommend, for some of my patients that if they're going to do acupuncture, they should at least go for 3 months consistently to really get the benefits of that. Sometimes massage can be quite helpful as well, particularly if you have a lot of strain and tension in your neck muscles or shoulder muscles. Massage can be helpful. Physical therapy can be quite helpful. Or sometimes even craniosacral or chiropractic therapy can be useful to try to restore musculoskeletal balance. And then sleep, I was talking about sleep earlier, but our sleep is really restorative for our body as well as our mind and our brain. So it really is important to try to get on a regular sleep schedule. Now, this is something I'm still working towards. This is one thing that I really need to still pay more attention to are my sleep habits. But what you want to do is, if you have a migraine brain, or if you have an easily triggered migraine brain, I would suggest, stay on a regular sleep schedule, go to sleep at the same time every night, and wake up at the same time every morning, no matter whether it's the weekday or the weekend, no matter if you're at home, if you're traveling. And I know many of us are probably not traveling right now during the pandemic, but try to maintain a regular sleep schedule, no matter if you're working or on vacation, it doesn't matter. Because our brain, again, craves regularity if you are prone to migraines. So that's very helpful. And then the last tenet or the foundation of my approach is calm. So let's talk a little bit about maintaining calm. So, I was talking about before how stress is just such a major trigger for many people. And, again, there are many sources of stress, and some we have control over and some we don't have control over. So, there's only so much you can do about the things that you don't have control over, but you can try to modulate your response to that stress. And so, that means figuring out what works for you and what combinations of things work for you to help improve your stress level. So for some people, that may mean doing meditation. For others, it may mean doing yoga. For others, it may be being out in nature, simply taking a walk, or doing some other activity out in nature. For others, it may be better time management, spending time with family and balancing that with work. That can be a source of stress relief. For others, it may mean listening to music. That can be a really effective way to help calm or reduce or relieve some of your stress. For others, it may mean going to therapy. Finding a therapist that you feel comfortable with and talking through some of your stressors and how you can deal with that. That can be a huge stress modulating therapy for many people. For others, it may be doing a spa day or just kind of self-indulgence a little bit, sleeping in and getting some treatments done. Sometimes that can be a very, very refreshing and rewarding and restorative in itself. And then for others, it may be finding some source of exercise to help relieve your stress, or and finally finding a hobby. So a hobby is really a wonderful way to relieve stress. It just kind of puts you in a different zone, something that's not stressful, whether it's some kind of art or craft project or gardening, or whatever it is that you enjoy doing, find it. And sometimes doing a hobby with others is also very effective at managing stress. And a lot of my patients, just want to just mention something about meditation, because it's really been clinically proven to help reduce migraines. A lot of my patients say, well, I really, I would love to meditate, but I don't know how. I've never done it before. What do? Do I sit cross-legged and say Om and close my eyes? My mind starts to wander. I don't know how to meditate. Well, what I would say is, if you've never meditated before, there are some wonderful resources to help you get started with meditation. There are some apps which are wonderful. There are apps called Calm or Headspace or Insight Timer, and many of these apps you can download to your phone or to your device. Most of them do have a free trial period, and then if you like it, you can purchase it for a nominal fee. And these are guided meditations that you can do. So, you can start off with doing, let's say, a 2-minute meditation, and then move on to a 5-minute or 10-minute or 15-minute meditation, and then work your way up to maybe even a 30 or 45-minute meditation. But meditation has been clinically proven to really help improve the frequency and severity of migraine. So that's one way to do it. Another way to do it is to do a class. And depending on where you are, you may be able to go in person, but in most, for most people these days, given the pandemic, it's probably best to do an online meditation. So again, a guided meditation where someone will walk you through the meditation. And, there are, again, various types of meditations, but mindfulness is one very effective way to do meditation, or a guided imagery meditation. These are just some options out there. And then, so also for Calm, I also recommend for my patients to use essential oils. And there are a couple of oils that I found to be most effective for migraine. My personal experience has been with a combination of peppermint and lavender and frankincense. Now, these are essential oils that you can purchase and mix yourself, or you can buy them already pre-mixed, and you can apply them either topically, meaning where you tend to get tension and headaches, you can apply them to your forehead, to the area around your eye socket. I really like to apply it to the base of my neck, which is where one of my headache triggers is, down into my shoulders. You can apply it topically. Do not get it in your eye. Absolutely do not put it in your eye, because it will really burn and sting. And also, when you do use it, you want to dilute it, because if you put it directly on your skin, it'll be too strong, it will burn and be very uncomfortable. So you want to dilute these essential oils if you're going to use them. You can do that. You can also do it as aromatherapy. You can put it into a diffuser and then breathe it in. I like to have an aromatherapy diffuser sometimes by my bedstand. And so that way it's running at night, and you can breathe in those essential oils throughout the night to help you calm. And I just want to spend maybe a minute or two about talking about light sensitivity. So this is also really a major trigger for many people. And it's important to try to calm yourself to prevent light sensitivity. It's important to use some kind of protective eyewear, or block out some of those wavelengths of light that may be causing the light sensitivity. So a lot of people ask me what types of sunglasses. So it's not just a dark tint that's going to be effective. There's a specific tint called an FL41 tint, and it's a pinkish tint. It's almost like it's a rose color, basically rose-colored glasses, and they block out certain wavelengths of light that have been shown to trigger migraine. And these wavelengths of light tend to be blue wavelengths of light. So these sunglasses, the FL41 sunglasses, you can get them from various different manufacturers online, but they can be very effective. Also, sometimes using screen filter apps can be quite effective as well. And then I do want to just talk a little bit very briefly about blue light and, currently, many of us are spending a lot of time in front of screens, so we can experience digital eye strain, but also the blue light that comes from these screens. All devices emit blue light, whether it's your phone, your computer, your tablet, television. All of these devices emit blue light, and they can potentially trigger migraines. So, so I would suggest, if you do have a predisposition towards migraine, and if you're on a computer for hours on a, at a stretch like I am, you may want to use one of those FL41 glasses. You can also download a screen filter to block out the blue light internally from the screen. So not just, some people may have an iPhone where they have night shift mode. It's beyond just a night shift mode. It can really adapt to the time of day and your time zone, and it really can block out the blue light according to the natural cycle of blue light that comes from the sun. So I would suggest using a screen filter if the blue light from your computer is triggering your migraines. And then also we have natural blue blockers within our eyes, and many people don't realize this, but we actually have blue blocking pigments in our eyes that come from foods. And so if we need to have enough of these pigments in our diet, and the plants that I was talking to you about before, especially the various colors of plants, will provide you with a lot of the nutrients that you need. The specific blue blockers include lutein and zeaxanthin, and so you can get it from foods. These are pigments that are in the retina in the back of the eye that help absorb and block blue light and protect our eyes. You can also get blue light, the natural blue blockers if you're not getting enough through your diet, which most people don't, unfortunately. You can also do this as a supplement. So there are blue blocking supplements out there on the market. There are many different brands. I would actually suggest something called Lutamax 2020. It's an ingredient in many of the brands out there that has the lutein and the zeaxanthin that are natural blue blockers in the same proportion as what we would normally get from our diet. And then finally, I just wanted to mention a little something about blue blocking glasses. A lot of people ask me, particularly parents whose kids are on devices all day now that they're learning from home, they're doing virtual online education. They're asking, should I be getting blue blockers when I'm on a computer? Should my kids be wearing blue blockers? Well, my response is that there is no proof that blue blockers really work in terms of preventing digital eye strain. But I will say that the FL41 tint is a very specific type of blue blocker. And if you're going to get blue blockers for migraine, make sure that you're getting the FL41 tint blue blockers. And just look for, or ask, wherever you're getting them from online or your optical shop, ask for that specific tint, the FL41. So I'm going to end there, and I know I've given you quite a bit of information, but if you'd like to learn more about migraines and some of my approaches to migraine, I have a lot of blogs on my website. So please visit my website. It's actually my full name, which is RaniBanikMD.com. And you can actually get a lot of that, that information. If you have specific questions, you can email me and my staff, and then we'd be happy to answer your questions. My office number is here. I also offer telemedicine consults. So if you would like to go further and consider some of my treatment approaches for migraine, whether it's pharmacologic or not, or combination of those, you can set up a telemedicine consult with me, and we can establish, a doctor-patient relationship and go forward from there. And I also want to say that I do have a lot of resources also out on social media. So if you're on Facebook or Instagram, please consider, on Facebook, please consider joining my Facebook group. It's called Eye on Migraine. I share a lot of great tips on how you can naturally improve your headaches. So some of the things I talked about, but a little bit more in detail. And then on Instagram, I do something called Migraine Monday, which is every Monday I share a lot of helpful tips about, whether it's food or food triggers or other lifestyle things you can do to decrease your migraine triggers and raise your threshold for migraine. And then finally, if you do go to my website, I have a migraine and headache resource page. And on that page, you can actually download, I have an ebook there called 6 Natural Ways to Conquer Headaches. You can download that for free. And over there, I also have a list of, a lot of people ask me, I'm going to get a supplement, but I'm not sure which one to get. So on there, you can actually find links to some of the supplements that I found most useful for my patients, but also the ones that I use myself. So you can find those there for example, the magnesium supplements that I use, and then the B complex that I use. And you can also find some of the essential oils that I use from trusted brands. I also have there the link to FL41 glasses. If you were looking for a trusted manufacturer of FL41s, this company actually sells glasses that you can wear, or glasses that go over your glasses, but also they also apply the tint to glasses. So if you have glasses that you want to send them, you can mail in your glasses and they will apply that tint and then mail them back to you. And then also finally, on my resources page, I have some of the meditation apps and the screen filter apps that I've talked about today. So I'm going to end there and open it up to any questions that you may have. And I'm actually going to go back here. So I'll just leave that up for now. And then finally, I just want to add one more thing. If you are interested in the mitochondrial diet that I was talking about with the therapeutic foods, and also to learn more about recipes and a meal planner that has all of those foods in it, sample meal planner, I do have that for purchase as well. So you can call my office or contact my staff and they will help you with that. And that's for $25. You'll get the mitochondrial diet as well as the weekly meal planner and recipe guide. So I will stop there and open it up to any questions that people may have.
So